Hi, my name is Kayla and I'm going to be your nurse today.
Hi.
Can I just have your name and date of birth, please?
Mackenzie Humes, 6/26/97.
Okay. So I'm just going to talk with you a little bit about Cushing's disease.
Okay.
I have this paper and this pamphlet here for you to follow along, and I'll do a little bit more explaining about it later. Cushing's disease is a condition that results in too much of a hormone called cortisol in the body. And cortisol is a hormone made by your adrenal glands. And if you see on the picture right there, they sit on top of your kidneys.
Okay.
And the cortisol allows people to respond to stressful situations such as an illness, and it has effects on almost all of your body tissues. It is produced by the adrenal gland mostly in the early morning. In Cushing's disease, too much cortisol is being made because another hormone called ACTH keeps signaling the adrenal gland to make more cortisol.
Okay.
So just some signs and symptoms, which you already know some of these because that's the reason why you came here to the doctor. But some abdominal weight gain, red, round, what they call moon face, buffalo hump, high blood pressure, high blood sugar, muscle weakness, thin skin, excessive hunger and thirst, and trouble sleeping. So your new medication, which is called Ketoconazole, is going to work by controlling the high amounts of cortisol in your body that has caused this Cushing's disease. And the drug inhibits the ACTH, which is the hormone I talked about earlier, which signals your adrenal gland. So this will cause no stimulation to the adrenal gland, which then will halt the production of cortisol.
Okay. I have a question.
Sure.
What is a buffalo hump?
Sure. So actually, if you open the pamphlet, there's a symptoms page right here, and there's actually a picture right here. So the buffalo hump is here on the back. So it's basically just the redistribution of fat into the back.
Okay.
So that's what. And then this also lists a bunch of symptoms.
Okay.
Could be helpful.
And is that the same with the moon face?
Same with the moon face, just
Okay.
like that's the term they use for just like redistribution to like the face.
Okay.
And then for this pamphlet, it's just helpful just because we're getting a lot of information today, so it'll be helpful to go back and look at it, like hits a lot of like key points. And then also I just want to point out to you, on the back here, they have a website for a support group, if that interests you at all, just for other people with Cushing's disease.
Definitely.
So do you have any more questions for me?
No, I think that's it. Thank you so much.
No problem. Okay, so if you don't have any more questions, if you don't mind, could you tell me just like a few things you learned about Cushing's today?
I learned that it causes the redistribution of fat to the face and the back, so that's called moon face and buffalo hump. And I learned that it's caused by high levels of cortisol in the body.
Okay, great. In my part of the video as a nurse, I used teach-back method with my patient to assess what they had learned, and then I also provided my patient with a brochure that they had information that they could go home with. And then I also used a picture to show them the anatomy of where the adrenal gland was.
Hi Kayla, my name's Mackenzie. I'm going to be your nurse today. I'm going to be giving you a little bit of information about Ketoconazole, which is the drug you're going to be on for your Cushing's disease. Here's a piece of paper that's got some information on it. It's exactly what I have, so you can follow along with me and ask me any questions. Can I get your name and date of birth, please?
Sure. Kayla, Brennan, 11/27/96.
Perfect. All right, so Ketoconazole is a antifungal medication, but it's going to be used to treat your Cushing's disease. So how to take this medication, you should take it as directed, and your dose may need to be adjusted to figure out what's best for you. It's best taken with food or milk. Take all of the medicine in your prescription. This medication should come with a medication guide. We can give it to you. If you don't have it, you can ask your pharmacist. If you're missing a dose, make sure to take the dose as soon as possible. So drugs and food to avoid, you're going to ask your doctor or pharmacist before using any other medications. That includes like herbal medications, over-the-counter, vitamins, that kind of thing. Some specific medications that you shouldn't use with them is alprazolam, cisapride, colchicine, disopyramide, and dofetilide. There are many medications that can also affect how they work. So tell your doctor if you're using carbamazepine, colchicine, dasatinib, and isoniazid. If you take medication to reduce stomach acid, so like an antacid, make sure you take it 1 hour before or 2 hours after taking Ketoconazole. So while using this medication, you should inform your doctor if you are pregnant, have liver disease, heart rhythm problems, adrenal problems, or stomach problems. Don't breastfeed while you're on this medication. This medication can cause liver problems, changes in heart rhythm. You shouldn't drink alcohol while you're on this medication. Call your doctor if you're not improving or you don't see like the dose is helping you. We can help adjust the dose. Keep all of your medication out of reach. If you have any children, lock it up in the medicine cabinet. Some possible side effects for this, to call your doctor right away if you notice. If it's an allergic reaction, you could see itching or hives, swelling in your face or hands, swelling in your throat, tingling in your throat, chest tightness, trouble breathing. Dark urine or pale stool, nausea, vomiting, diarrhea, loss of appetite, and pain in your upper stomach, yelling of the skin or eyes. You might see dizziness, fainting, lightheadedness, fast pounding, or uneven heartbeat. And if you notice these less serious side effects, you should definitely still talk to your doctor. Headache, problems having sex, and swollen breasts in males, but that's obviously not applicable to you. If you notice any other side effects that you think are caused by the medication, reach out and call your doctor. Or if you feel like you need medical advice about side effects, you can report any side effects to the FDA number, and that's right below. It's 1-800-FDA-1088.
Okay.
Do you have any questions that I can help you with today?
I actually do have one question. You mentioned that I can't take an antacid until after. I'm just wondering, why is that?
So when you take an antacid, it coats your stomach, so that prevents the absorption of the medication. So you should take it before taking that or wait till after so it doesn't affect the absorption of it.
Okay.
Okay, any other questions today?
I think that's it.
Okay, perfect.
Thank you.
You're welcome. All right, so if you have no other questions, I'm going to ask you to tell me a little about what you learned today.
So I learned when to call my doctor. So if I have an allergic reaction, so itching or hives or redness or swelling on my face or throat.
Perfect. Thank you. In my part of the video as a nurse, I provided the patient with an information sheet of the medication as well as using the teach-back method. And in addition to this, I provided the patient with the FDA number to call if they were experiencing side effects.